Hello, my name is Yesenia Gomez, and my main topic for my final presentation for Social Science 3A is on the high rates of COVID-19 and minority and low income groups. Some simple background to my topic. My overarching question was, what are some of the primary factors that contributed to like how high COVID-19 cases in minority and low income groups? So here I kind of provided a simple point. Um, so like this was provided from the public health data in LA County, and there were over 1 million COVID-19 cases in LA County, and of these 1 million, about 6 to 700,000 were of Hispanic Latino background. So if you put into perspective, that's about 50% cases being of Hispanic Latino background in LA County. So that got me thinking, like, why is it that some Hispanics or other racial and ethnic minority groups tended to get high COVID-19 rates in comparison to others? So adding to that point, this is where I got my data. This is from the LA County Public Health website. And as you can see, you could start seeing the disparities in COVID-19 cases as well as in deaths in certain racial and ethnic groups, which is something to keep in mind for the future slides to show. So moving on, when considering this overarching question, you start to think what factors could have contributed to high rates of COVID-19 in minorities slash ethnic groups. And so I started to provide a couple of questions such as, do they have adequate access to isolation or quarantining in their own homes in case of an active COVID-19 case? Another could have been like, are they able to afford to be able to isolate or quarantine themselves? And lastly, are there certain groups that are more susceptible to catching COVID-19? And are they more susceptible to certain health complications in case they were to catch COVID-19? So therefore, this is how I kind of came up with these three hypotheses. So one being occupation, the second being income, and the third being race slash ethnicity. For occupation, I mentioned that minority groups are more likely to work in high risk COVID-19 workplaces than other groups. And for income, low income groups are more likely to have difficulty with isolation slash quarantining themselves in case of a COVID-19 infection. And lastly, for race and ethnicity, Latino and Black communities are more likely to be infected with COVID-19 and more likely to have health complications in comparison to other groups. So to begin with, to analyze my first hypothesis and variable is understanding this main question. Who was most likely to be working in high-risk occupations? So in this CDC report study, it mentioned that COVID-19 workplace outbreaks in the state of Utah consisted of manufacturing, wholesale trade, and construction. All of these consisted of 73% being Hispanic and non-white workers. In addition, in a journal article provided on Science Direct, it mentioned that about 28.4 million foreign-born residents were working in the United States, many of which worked in agriculture, cleaning, construction, and so on. So, just to keep in mind and put into perspective, many of these workplaces consisted of in-person working conditions. So, this meant that they were more likely to be catching COVID-19 than those who had the privilege to be able to stay at home and work from home. So, moving on, to analyze my second hypothesis and variable is understanding this main question. Who was able to isolate slash quarantine themselves in their own homes, and who could afford it? So, in this journal article published by the ACP journals on feasibility of isolation and quarantine, it mentioned that a total of 81 million people weren't able to quarantine or isolate themselves within their own homes. And this odd was actually 2 to 3 times higher for non-Hispanic Native Americans and Hispanics in compared to whites. And in Black and Asian individuals, they were 1.7 higher odds of being able to not quarantine or isolate themselves. So in addition, I provided some data from the Pew Research Center that kind of shows that not only were minorities slash ethnic groups affected, but also low income individuals. You could clearly see here, and if you look at all the bars, low income individuals had the highest bar in terms of finding it very difficult to somewhat difficult of being able to quarantine if they had COVID-19. Lastly, to analyze my last hypothesis and variable is understanding this main question. Are there certain types of groups that are more susceptible to catching COVID-19? And are there factors that could contribute to complications or higher mortality rates? So I provided a research article that was on Science Direct on COVID-19 disparities amongst groups in different states. So it shows that incidence rates of COVID-19 were high in African American and Latino communities. In addition, 24.4 of COVID-19 deaths were actually African American. So here I provided some data that was presented in the research article. The black lines represent the percentage of African Americans in that state's population, and the blue bars running across, the page represents the percentage of African Americans that had COVID-19. So, a lot of these, bars and black lines actually are really close to each other. So it just kind of shows how high the incident rates of COVID-19 were in the African American population. And this is another graph, and this is on Hispanics and their incidence of COVID-19 in um, certain states across the United States. So continuing on the variable of race slash ethnicity, we kind of get an understanding that certain groups are more likely to catch COVID-19. So if they are more susceptible to it, what are some contributing factors to high mortality rates for these certain groups as well? So here I provided a research article on public health issues facing certain racial slash ethnic groups. And it mentioned that health conditions such as cardiovascular disease, hypertension, and diabetes were more likely in Asian, minority ethnics, and blacks than in whites. Um, so this kind of help give a perspective of what underlying health conditions certain groups were more susceptible for. And so, in the case of like blacks and minority ethnics, such as Hispanics, you kind of get an idea as to why could have been high mortality rates, given that they could have had more likelihood of having complications as well as long-term health conditions if they were to have caught COVID-19. So, in conclusion, when you keep in mind all these variables and factors presented in these hypotheses, it helps understand what could have been done differently, knowing that these factors could have contributed to the high rates of COVID-19 and mortality rates in racial slash ethnic groups as well as low-income communities in the United States. So that comes with the understanding that if there had been more adequate access to healthcare services, more open spaces for isolation slash quarantine, and more resources and financial help for those who did not have access for it, it could have gone differently for racial slash ethnic groups and low income communities in the United States in terms of COVID-19.